So when you're diagnosing and making the treatment plan for patients with these myeloid malignancies, these are like acute myeloid leukemias, almost all these diseases are defined by some type of molecular event. It's really critical that you do genetic analysis because it has implications on their treatment, their prognosis, and fundamentally their outcome. So the first step in a diagnosis is getting a sample. So it can be peripheral blood or bone marrow, oftentimes both. And then from there, it's an amazing diagnostic odyssey with leukemia because it has multiple components to it. It's important to get quick turnaround times when you're testing for acute myeloid leukemia, is that oftentimes these patients present when they're ill. These patients are not stable, and in fact, there's certain types of leukemia where they're making so many malignant cells, it can actually cause coagulation problems and lead to strokes and can be fatal very rapidly. There are reference labs in the United States where you can send your sample, and they'll do the testing there, but there's delay. You have to ship the sample. The sample may arrive either, and it might be too scanty. You might not actually have enough material, or it could get damaged in shipping. So in some ways, the sample gets divvied up in these different labs, which may not even be in the same building, are doing these reports, and then the reports come back out. One of the exciting things right now, especially with the technology with next-gen sequencing, and as the panels get bigger and bigger, you can start to consolidate some of this testing so that the clinician, when they get these results back, has all the information they need to make a fully informed treatment decision. Another instance, I think, where next-gen sequencing can be critical is when patients, the diagnosis is hard, it's not precise, and you find a certain mutation that can help clinch the diagnosis. So the patient may have a disease that may resemble almost a lymphoma, for example, and then you find a mutation and it changes the diagnosis to a myeloid leukemia, which has a completely different treatment regimen. And so there are instances where the mutation can completely be the linchpin or the clincher in the diagnosis. And you do see that, and that's exciting because a lot of times an oncologist will contact you and go, oh, that's what I was thinking, but I couldn't really prove it, but this mutation really helped me out a lot. And that had historically been a send-out test. Now we can bring it back in-house, give more rapid results, and getting that level of sensitivity they need to really dial in the therapy and make sure it's working. Now with amplicon-based testing where I work, we have a pretty large volume of heme malignancies, AMLs coming through. So the volume isn't a problem, and we use an amplicon-based approach for testing our AML patients, where we make libraries using DNA and libraries making RNA, and then we sequence both of them. So typically at the time of diagnosis, they'll order both DNA and RNA, and we kind of run them in parallel, and we have very rapid turnaround time. I'd say by the time the sample arrives in the lab, we're pushing reports out between 2 to 4 days. We found at our institution that we have a very good, close relationship with both our heme path people, the people actually working up making the diagnosis, and the oncologist who's fundamentally treating the patient, and then the molecular lab. I think that type of communication is really important to making sure that the results are good, that the results make sense, that certain variants that may be at a low level are observed and appreciated because they might have a history of having that variant. What I'm excited about the future is with automation and rapid testing is that it isn't just restricted to acute myeloid leukemias. It can be happening in the germline space, and then you can consolidate labs, you can cross-train your technologists, and just be a lot more efficient and have redundancies built in that can make sure that you can deliver results when they're needed.